If you want to help your pet live longer, there's only one mechanism that is proven to work in every species, whether they be mice or monkeys or dogs or cats or humans, and that is.
Welcome to the Secrets of Being podcast. I'm Dr. Dawn Earhart Whitty, your guide on a transformative journey of personal development and discussions of universal truths. Join me and a panel of life coaches and spiritual leaders from around the world discussing how to handle some of life's greatest challenges. We will be sharing stories of love, faith, and inspiration with you, our faithful listeners, to live your happiest and most fulfilling life, full of purpose and passion for yourself, your families, and the world. We are here to be the change we wish to see. Let the conversation begin. Hello, and welcome to the Secrets of Being podcast. Today, I am absolutely honored and thrilled to be joined by Dr. Kevin Toman. He's a veterinarian. He is the longevity vet, which I love, and he's also the founder of Helping Pets Live Longer. And anybody who loves their animals always want to know how to make the pets live longer. So thank you so much for joining us, Kevin. Welcome.
Well, thank you very much, Dr. Don. I appreciate the time. And I also want to say that I know very personally how much effort goes into a recurrent podcast. And so your listeners are very lucky to have you in their corner because people don't understand all the effort that you put into it. And so thank you for the work you've done in spreading the word around wellness.
Oh, thank you. Thank you so much. I always like to start the podcast off with a quote. And the one that I love so much, I've used a couple times. So I was looking for another one that would be good. And this one's by Immanuel Kant. And he said, "We can judge the heart of a man by his treatment of animals." And I love that so much.
Okay. And I think that's well placed. Absolutely. No argument at all. And I've seen in 40 years of veterinary practice, I've seen both the highs of that and I've seen unfortunately some lows as well. And so, yeah, but that's a very cogent statement. Absolutely.
Yes. Well, would you tell us a little bit about your journey, how you got to be the longevity vet, how you got into that niche, and
Okay.
were you always an animal lover? Is that how you went into veterinary medicine? Like, tell us a little bit about your journey.
Absolutely. And so I am that guy who knew from early childhood that I wanted to be a veterinarian. And I graduated from veterinary school back in 1986 and began a series. I've opened 8 or 9 veterinary practices throughout that time, but mostly in California or in Colorado. And as I progressed through my veterinary journey, I just found the challenges of older pets, the cancer care, the heart care, the chronic pain care to be the most rewarding part of my journey. And I was kind of pushed out of the nest, so to speak, when in 1 month I saw 3 different older pets that were having to be rehomed because their pet parent, their caregiver, had died or had gone to a nursing home. And that just broke my heart because of all the challenges that an older pet deals with, with the cancer, with the chronic pain, et cetera. The last thing in the world they need is to go through a shelter setting and be rehomed. And so I've worked closely with older pet shelters since that time. And as luck would have it, I have a little bit of expertise, a little bit of a passion, as you described, around the healthcare of these older pets. And so the next step was just devoted myself entirely to the care of these older pets, and that's where I stand right now.
Yeah, so you have to give us the magic formula. How can we keep our pets here as long as possible?
Okay. Well, so I wish that it were just a simple one sentence or one paragraph answer, but the reality is that I think of it as a four-tiered framework. The first is talking about diet and lifestyle. And Dr. Don, you and I can spend however long you want to talk, chatting about each one of these pillars. But the first pillar is simply diet and lifestyle. The second is involving your local vet because some pets need dental care and all pets need diagnostics. The third component to it is supplements that you can trust. And the fourth is actually prescription longevity drugs that come straight out of human longevity medicine. And one drug, for instance, is rapamycin, and that has been proven to extend lifespan in every mammal species studied to date by up to 14%. Why wouldn't we use something like that in our pets? There's no answer. We do. We want to.
And I did a little bit of research because I'd never heard of it before. But
Hmm.
isn't that like a
a drug for people to not reject organ transplants?
That's the way it started. You bet. 20 years ago, 25 years ago, rapamycin came into the human medical field as an immune suppressive drug, so that if I gave you my kidney, you would need to be on rapamycin or one of these other drugs to prevent your body from rejecting it. However, along the way, what we have learned is that rapamycin extends lifespan, again, by up to that 14%, which, by the way, is over a year for most of our pets. And it does it in two ways, Dr. Don. First off, by reducing cancer incidence, and second, by reducing inflammation. And the current theory around inflammation is that that's one of the primary drivers for our body's aging. So whatever you and I can reduce inflammation, whether it be dental disease, whether it be skeletal pain, whether it be allergic disease, we can add years to our pets' lives.
Hmm. And then you talked about diet. And when somebody tells me they have a dog that's lived, 16, 17 years, a larger dog too, I always say, my first question, what do you feed them? Like, I want to know, what do you feed them? I cook for my dogs because I'm such a
Add a
weirdo
girl.
about
Add a girl.
keeping. Yeah.
I
So,
cook for my dog too, so I'm going to join you in that weirdo category. And so I'll answer that right off the bat because there are two different components to diet therapy for when it comes to longevity. One is the most interesting is this: if you want to help your pet live longer, there's only one mechanism that is proven to work in every species, whether they be mice or monkeys or dogs or cats or humans, and that is calorie restriction. The thinner you are across the board, the longer you will live. And so there was an interesting study done by the Purina Dog Food Company about 12 years ago. And in it, they divided Labrador Retriever litters. And so if that litter had 8 puppies, they took 4 and fed them just whatever they wanted to eat for the rest of their lives. And then they took the other half, the other 4 puppies in my example, and limited them to about 3/4 of what a normal dog would eat. And they followed these puppies throughout their lives. And there were hundreds of dogs in this study. And what they found, Dr. Don, is that the thinner dogs lived 1.8 years longer than the dogs who were fed, whatever they wanted. And these were dogs that were kept in the same environment. They were attended by the same people. They were given the same vaccines. It was the same diet, just differing amounts. And so the only possible explanation for this was the reduced calorie intake of the longer lived pups. So that's one component. And then the second thing I'm going to mention is that, listen, I'm 66, and for 50 years or so of those 66 years, I fed my dogs kibbles because that's what I thought was the very best. It was certainly the easiest. It's the most convenient, to be sure. But about 10 years ago, we started learning that in order to glom those kibbles together, to make them form, make them stay in that kibble shape, it takes carbohydrates, it takes starches to do that. And then when you run those starches through a high temperature cook oven, typically over 450 degrees or so, what happens is not only are you creating are you browning those kibbles, but you're also creating what they call advanced glycation end products, or AGEs, which are actually carcinogenic. And so the moral to the story is that you, Dr. Don, are exactly correct. If you want your dog, if you want your cat to live longest, we need to replace in its entirety their kibble diet. Stop the kibbles. And whether you use a homemade diet like you and I use, whether you use one of the premium diets that are shipped to your door, whether you just simply use the very best moist diet that you can find purchased from a grocery store, any one of those will help your dog or your cat live longer than the old-fashioned kibble diet that I used for many years.
yeah, that makes sense. And I had a friend that was staying with me from Portugal, and she was the one that introduced me to cooking for my dog is having a field day
No,
on the
no.
ground right now. Yes, Benny, this is good. He knows what we're talking about him. But
What
she was
kind,
the
what kind of a dog is Benny?
we're not sure. He was a rescue from the streets of downtown LA, and he's
Uh-huh.
almost 12.
Okay.
So I really look at what I feed them so carefully because I want them to be here as long as possible. And I've
Absolutely.
had 17 dogs in as an adult, not at one
Wow.
time, not at one
Okay.
time, but over
No
the
wonder
course.
you're doing another podcast.
Well, because I love animals, I love them.
Yeah.
I losing them always is like it's the hardest part of having a pet.
It
And
sure is. Yeah.
I put myself through it over and over again, even though, it breaks your heart. But, the love
It
that
is
we
a
get.
trade-off. It is a trade-off, but dogs and cats bring so much to our lives. And let me emphasize one thing. My little dog, Annabelle, she's 18 months. She's a golden retriever puppy. And listen, I love her. And I've had another golden retriever named Brooke, who is very near and dear to my heart. But golden retrievers, bless their little hearts, are 4 or 5 times more prone to get cancer than any other breed of dog. And so that's one of the reasons that I home cook for her. And as an example, every meal that my dog Annabelle eats has broccoli in it, not only because it will fill her up. She's a very food motivated dog, and I don't want her getting fat on me, as we just discussed, but because broccoli contains an ingredient called sulforaphanes, which are known cancer fighters. And so if you and I or your listeners pick the specific diets that they are pick the specific ingredients that they are feeding their dogs or their cats, there's absolute longevity advantage to this. I mean, there's no doubt. Using the Purina study as a baseline, you and I can increase our pets' lives by up to 15% or so using nothing but dietary therapy.
Oh, I love that. And I don't use broccoli. I use green beans and peas and carrots,
Okay.
but I'm going to add broccoli to that mix. Thank you very
Atta
much.
girl. Atta girl.
So because you focus on longevity and you've been in the field for over 40 years, what made you walk away from the traditional veterinary practices? Because I think in humans and in animals, I think we're kind of looking at the way those models are structured and saying, maybe this isn't for our healthiest.
Yeah. Well, I'm going to make an admission here, Don, and it pains me to say this, but I think veterinary medicine is broken. And I say that because well, for the biggest reason is this, and I'm stuttering and stammering when I shouldn't. The biggest reason for the failure of veterinary medicine to thrive at this point and to meet the needs of pet parents like you is because there's been this huge influx of corporate ownership into the veterinary world. When I graduated from veterinary school back in 1986, every veterinary clinic that you saw was owned by an individual like me. And now only about 1/3 of veterinary clinics in the United States are owned by individuals like me. The other 2/3 are owned by by these mammoth corporate businesses, including, for instance, Mars, the candy bar maker. They are the single biggest owner of veterinary practices in the world. And so as a result, what is happening is this. Instead of you and me developing a relationship around Benny's care, seeing him as a young dog, seeing him as a middle-aged dog, seeing him as an older dog, the corporate ownership is telling you, listen, you have 20 minutes to visit with this particular patient, and we want you to recommend these particular drugs, and this particular vaccine protocol. And it doesn't really make any difference whether that's what's best for Benny or not. So the ability to build a relationship with pet parents has been lost somewhere along the way. The ability to develop a structured longevity or structured health protocol for dogs like Benny has been lost because these veterinarians have to obey their corporate masters. Makes me sad to say it, but it's true. And so that's the primary reason when I sold my last practice, I chose not to re-enter practice. I'm in a consulting business right now, which means that if you and I want to talk all morning long about Benny's healthcare and his risks, you and I can do that. There's nobody watching the clock except for you and me. And that's what enables me to offer the folks the best in concierge medicine, along with the supplements and longevity drugs that they need.
Oh, I love that. And you know what? I think that extends to human medicine too. I think we've
Probably so.
lost the
Probably so.
that connection and we're
Hmm.
just doing what we're being told by corporate.
Yeah. And the reality is that I think at its best, medicine, whether you walk on 2 legs or four, is a relationship game. The closer that I know you, the closer that I know Benny, the better decisions that you and I will be able to make for your boy. In the absence of that, we're just guessing.
Well, so at one point when I was young, 1986, when you graduated, I actually just graduated high school. But I thought I wanted to be a vet. I wanted to be a psychologist, But then I thought, oh, I don't want to listen to people tell me their problems all day because that will just wear on me. But then I thought, but I love animals so much. But then when I started thinking about it, I was like, bless you. I was thinking, um, I can't like watch an animal die. I can't put an animal to sleep. That would crush my heart too much. And so, and when I joke around, but it's true. Like I work with children in my volunteer work and things like that because you can't take them all home. If I worked with animals, I would have like 100 animals in my house.
Understand. And that is a risk. I have done that myself.
Okay, so so it's real. It's a real thing.
It is real. Yes.
Um,
Mhm.
but I want to get back to talking about the longevity part because that's very important. And I know anybody who loves their animals, they want them around for as long as possible. But I want you to share a few maybe touching stories that you've experienced throughout your years of practice about that human animal connection because I feel like it's so important. People who have never had the blessing of living with an animal, they could be like, oh, they're dirty and why would you want to live with an animal? But there's something so special about it. And I want, from your perspective, I want you to share a story or two with our audience because again, that bond is so special.
Absolutely. And I would say that there's study after study now in the literature talking about how older folks with pets live a longer and a more fulfilled life than folks without pets. And I think that's clear. I mean, the reality is that many of us have kids, as we go through our lives, or you're busy with a profession, but there's nothing more important than building a relationship as we age, whether the object of that relationship walks on two legs or four. And so some of the most rewarding cases that I've worked on are just simply helping these pets who accompany older individuals live longer. And many times that, these are older dogs or older cats. And so they come with their own form of cancer concerns. And in one particular instance, I was dealing with a little schnauzer named Abby. And Abby had developed an oral tumor called melanoma, and this is a fast mover. It's a tumor that will eventually cause death. And we were able to go ahead and do a combination of surgery, and then we started her on the longevity drug rapamycin. And the oncologist, the cancer specialist, had given her only 4 months to live after diagnosis, which just, I mean, every time I saw Abby's mom, she just cried and cried and cried. But we were able to give Abby another 4 years of life with the longevity protocol. And it was just a wonderful time. They traveled together. Abby would be taken on airlines. She went to the beach, she went to the mountains, and just had a full and wonderful life for an additional 4 years using the things that you and I can talk about. And that meant the world to Abby's mom. In fact, she and I still talk to each other on the phone periodically. You get involved with these people. You learn to love the pet love the parent as much as you love the pet. And so she and I still talk on a regular basis. And that was just one instance of where my line of work, my passion, was able to help somebody else and better enjoy their life.
So, okay, you said the diet and you talked about rapamycin in this. What are other things in that protocol? Is there more to the protocol?
Yeah, well, like I said, there's four different ways that you and I can help our pets live longer. We talked about diet. I'm going to mention lifestyle. I'm going to talk about dental care and diagnostics on the part of your veterinarian. We'll segue into supplements a little bit, and then we can wrap things up with the prescription longevity drugs again. But, I'm just going to give you a fast overview, but feel free to interrupt me wherever you'd like. So we've already talked about diet and how both quantity and quality of diet will add months to years to your pet's life. The second component to this is, and it's very important for large breed dogs. How old is Ben, or excuse me, how much does Benny weigh?
Benny's probably 60 pounds. He's like
Okay.
medium, but I have
Oh, okay.
two Great Dane Border Collie mixes, so
Okay.
they're bigger.
All right, perfect. Yeah, so the big dogs that you love, I would tell you that one of the proven ways that they are going to age is joint disease, the aches and pains that accompany getting older. And so how can you and I minimize that joint pain? Well, one of the ways is to minimize stairs in their environment. Every time they go up and down their stairs, when they go down, they're hurting their elbows. When they come up, they're stressing their knees and their hips. So whatever you and I can do to reduce the round trips up and down a set of stairs or jumping in their environment, the longer that pet will live. The other thing is, and I will bet you a six pack of beer that when you, Dr. Don, come home after a long day of work, that the dogs hear you coming and they run from the bedroom wherever they are and they run through the hallway and turn right at the kitchen and head to the door or whatever. And so many dogs slip and fall as they run. And so I'm going to tell you that every time dogs slip and fall, they're hurting themselves and that this inflammation and pain is cumulative. So whatever you can do, if your dogs have a traffic pattern and you have smooth floors, please think about just throwing an old yoga mat down in those corners where the dogs change directions. Think about rubber back throw rubs from Walmart. I mean, something that costs you 20 bucks, but whatever you can do to eliminate that slipping and falling will add to your pet's life. So when it comes to the other end, I'm sorry, I didn't mean to interrupt you. Yeah, does that make sense
Oh
to
no, I
you?
said wow. No, I said
Okay.
wow. I would have
Yeah,
not thought
okay.
of that.
No, no, because I want to make it's easy for me to get carried away on this, stand up on my
Please
little
get carried
soapbox
away.
here.
I love
And
it.
so, so you have large breed dogs, but in the past, I adopted a couple of small dogs, Cavalier King Charles Spaniels, because their older parent was being put into a nursing home. And as a small dog, the primary source of inflammation for them is actually dental disease, Dr. Don. And so I'm going to tell you that for dogs under 25 pounds and for cats, the single best way to reduce inflammation in them and therefore to prolong their lives is with anesthetic dentals, where your veterinarian knocks your pet out so that they can take x-rays of every tooth in their body and evaluate that tooth for disease, and that will enable them to treat it or to extract it as need be. Non-anesthetic dentals just don't work because you cannot take x-rays in an awake pet. They won't lean back and open their mouth and hold that position until the x-ray is taken, just like you and I do in a dentist's office. So that's, if you have if you have a large breed dog, you and I should chat about orthopedics, Dr. Don. That's really their chink in the armor. If you have a small dog or a cat, really any discussion around longevity should be centered around their dental care. And we can talk also about diagnostics. I'm a big believer in functional medicine testing, where you and I look at blood tests or urine tests perhaps every 6 months or so that we can detect patterns, we can detect trends before symptoms develop. Current veterinary medicine looks for symptoms after they develop. We're pretty good at diagnosing a disease. We're pretty good at sewing up a cut. But wouldn't it be nice if you and I could work together to prevent those diseases from occurring in the first place? So we need to use early diagnostic testing. So that's really the role of your local veterinarian is in dental care and diagnostics. I'm going to suggest that for many years, vaccines were the biggest part of a local veterinarian's care. I'm going to tell you that most dogs, most cats are over vaccinated. And it would tell you very specifically that every time I vaccinate a cat, I'm increasing the risk of skin cancer in that cat. Every time I poke a needle through a cat's skin, they're very likely to develop skin cancer there. And so I can tell you that over my 40 years in veterinary practice, I know that I killed probably 6 or 7 cats by vaccinating them. It was not by choice. It was not out of desire, but it was an inadvertent a side effect of the vaccines that I was given. And so whatever you do, whether you have a dog or a cat, please, the biggest thing you can do, ask your veterinarian why my pet needs these vaccines. Now listen, every pet needs rabies vaccines. I don't doubt that. But if your pet is not exposed to other dogs or other cats, then that's the time to start limiting the vaccines that are being used. All right, I'll take a breath there for a sec. Do those things make sense to you?
Oh, absolutely. And I'm 100% in agreement with you, but I'm not a veterinarian, so I can't, but
No, you're way too
intuitively.
smart. Way too smart to end up down that road. And
But
then the third component to this, okay, go ahead.
no, go ahead. I want you to finish because I have another
All right.
question that tags on to that.
All right. So I'll back clean up like this. There is and this might surprise you, Dr. Don, but there's an awful lot of bull around supplements in the world, and whether those are human supplements or veterinary supplements. And so we only carry 17 supplements, but I can tell you exactly why I carry each one of those products and whether it would be a benefit to your pet or not. As examples, the old days of you and I using glucosamine and chondroitin to help our painful joints or the joints of your pet, like of Benny, for instance. Now we know glucosamine and chondroitin doesn't work. The science has changed, and so you and I need to look at the current science to develop more current strategies around how to help Benny and how to help my dog Annabelle keep comfortable. And the strategies that worked 20 or 30 years ago don't work anymore. They've been proven not to work. And so let's you and me pick out supplements that are very specific to Benny's needs or to your other dog's needs. And then finally, the fourth pillar is the prescription longevity drugs that I spoke of, whether it be rapamycin or a product called acarbose. These are the most expensive things that I sell, to be sure. But again, by taking one pill 3 times a week, the reality is science tells us you and I can add 14%, up to 14% to your dog or your cat's life. And so, yeah, that's a quick tour through my world. One of the things, I guess the last thing I should mention in fairness is that if your pet parents or cat parents, 1 out of 6 cats will die from a fatal heart disease called hypertrophic cardiomyopathy. The very same longevity drug that you and I have spoken about, rapamycin, has been proven to stop that disease. And so if you it's the most amazing revolution that has come down the road in cat medicine in the 40 years that I've been practicing. The same longevity drug that will increase a pet's life can also prevent the most common heart disease in cats. All right, I'm
And
going to take a breath.
do you use that like a supplement, or do you use that when there is a diagnosis?
You, well, that's a very interesting question. And so I would tell you that in the case of cardiac disease for kitties, we use that based on a diagnosis. I would also tell you that many folks, because of its safety and because of its known longevity benefits, are starting to use rapamycin on a preventive basis for even young dogs and young cats because it is such a safe drug and there are clear benefits to its use. So that's really the next step, Dr. Don. If you were to ask that question in 2 years or 5 years from now, I suspect that a larger percentage of the parents that I deal with will be using these drugs on a preventive basis in their young pets rather than on a treatment basis in their older pets.
Oh, okay. Thank you for that. So what I was going to ask you is I wanted you to explain to the audience because not everybody knows what integrative and functional medicine is.
Okay.
Can you explain that? Because I think about that for people and for animals. I'm really much more of that woo-woo kind of, looking for alternative therapies, whether it's laser
Yeah,
treatment, things like that. So can you explain what that
atta
is?
girl. Well, so yeah, let's talk about integrative or holistic is another phrase that people use, people bandy about. And when I graduated from veterinary school back in the dark ages of 1986, I was very well versed in how to use needles and pills and scalpel blades. That's what a traditional veterinarian uses to help your pet. But studies have shown, tradition has shown that there are vast benefits to the use of herbs. There are vast benefits to the use of the lifestyle and the diet changes that Dr. Don and I have already spoken about. And there are vast benefits to acupuncture and laser therapy. Now, to be clear, I still use scalpel blades, I still use pills, I still use needles. But the reality is that if I limit myself to just one or two of those modalities, I'm not doing the best for your pet. Let's use a scalpel blade when we have to, or a pill. But let's also use herbal therapy. Let's use ultraviolet therapy. Let's use laser therapy or acupuncture. And only by introducing all those different means of treatment can you and I maximize the health of your pet. So people ask me if I'm a naturopath. No, I'm not. I don't limit myself to the use of herbs and other natural therapies. I will use whatever I can whatever treatment mechanism I can to help your pets. So that's my definition of an integrative veterinarian.
Oh, I love that. I love that. So to Okay, when you're cooking for your dogs, give me the recipe.
Okay. So I'm going to tell you that for my little princess Annabelle, it's typically it's a mix of chicken, and a lot of times I just use ground chicken from Trader Joe's, vegetables, fruits, and a little bit of rice as well. And the reality is that of those ingredients, I believe that the broccoli. So I buy her 1/3 of her diet consists of broccoli. And then 1/3 of her diet in general, probably a half of her diet consists of the meat component. And then there's a little mix of vegetables and fruits on a rotational basis. You should know, however, that if you are going to cook for your pet, that you have to be cautious about the balancing of that diet. And that's why I use a rotational component. I'm always changing the foods in there in an effort to go ahead and eliminate any nutritional deficiencies. But if there's any doubt, there are a number of different nutritional analysis sites on the web. Something like Balance It, for instance, where you can send the ingredients, send them a list of ingredients, and they will tell you whether that diet is nutritionally balanced for your pet. And one of the things I want to emphasize in particular is that for many years, people were being told that grain-free diets were healthier for their dog or healthier for their cat. And perhaps they are as a rule. But if those diets, if those grain-free diets are low in a specific amino acid called taurine, you are setting your pet up for heart failure longer term. And so if you guys are using a grain-free diet and they're still around, and many of them are still, they're a quality diet, but many of them just simply don't have the taurine in them that they should. So either have that diet analyzed or take the insurance route and spend 20 bucks a month. Give your pet some taurine if you're on a home cooked diet or on a grain-free diet. Makes a big difference in their long-term care.
So I've heard of taurine. Where is that found in? Is that in rice?
Yeah, it's widely found in legumes, in the beans and that you've spoken about. It's found in a lot of different grain products. But the hard part is that our bodies need that. It's not optional whether we eat that or not. And if we don't eat it, the first place that you run into problems is our heart. And so it creates a particular disease, especially in large breed dogs like yours, called dilative cardiomyopathy. And it just prevents the heart from beating as normally as you and I would like. The only way that they can get this is through a taurine deficiency. Therefore, the only way you can prevent it is by giving your dog supplemental taurine. It's a very cheap product. You can find it online in any number of sites. I sell it, but so does your pharmacy. So, I'm not looking for, I don't have a horse in this race, but please, if you're using a grain-free diet or if you're using a home-cooked diet without nutritional analysis, if you hear nothing else from this podcast with Dr. Don, please give your pets taurine.
I love that. Thank you. Like that is so helpful. And again, I'm always looking for good things to feed and to supplement. And, I've tried all the different supplements. And because Bentley's
Hmm.
getting older, um, I found one that I really, really like. And I noticed a difference because I was spending all kinds of money buying this and that and the other and not seeing any difference, not seeing any difference. And the one that I started
Yeah,
using now, I can see the energy level because
perfect.
other dogs they're puppies. Well, they're one, but
Okay.
they and he goes and he gets in there and plays with them now because I've been adding this. I hope that's why it's happening, but that makes me happy. So yeah, I'm going to check out your site and look at all the things that you've got going on with your supplements and things like that because again, that what I've seen this so many times, like the only time your pet is going to break your heart is the day they stop speeding. And so
That's for
anybody that
sure.
loves them, they want to keep them around for as long as possible.
Yeah, absolutely right. Absolutely right.
Well, would you tell us where people can find you? Because I'm sure there are going to be so many people that want to find you and find out what you know, pick your brain, maybe consult with you just to, keep their pets around as long as possible. And also leave our listeners with one nugget or something really, really important that you want them to take away from this podcast today.
Okay. Well, the nugget that I would leave you with is how lucky your listeners are to have you in their corner. because you provide a tremendous service to folks. And the knowledge that you bring to the table, I mean, you can't find very often, you can't find very widely. And so, I just appreciate everything that you do for your listeners because I know how much work it is. So thank you. That's my nugget for the day. And in answer to your question about how folks can reach out to me, listen, I specialize in pet longevity. I run a website called www.helpingpetslivelonger.com. And that's what my team and I do 7 days a week. So I offer concierge consults that are specifically tailored to the needs of your pet. I offer supplements, I offer prescription longevity drugs that Dr. Dawn and I have spoken about. But more than anything, I want you to know that we're in this together. And so I've created a free little resource for your listeners. It's called www.freevetcall.com. So if they go to freevetcall.com, all it is just a little button, click here so you can access my calendar. And I would be honored to give your listeners 10 or 15 minutes of a free consult where they can ask anything they want about their pet's diet or their pet's lifestyle or their pet's supplements or drugs that they're on. However I can help your listeners, I will. We are in this together, and I will help you if I can.
Oh, thank you so much. We will include all of that in the show notes so people can find you. And I hope they reach out to you because, again, our pets are babies. They're our fur babies. And so we want them around as healthy as possible for as long as possible.
Yep, agreed.
Yes. Well, Dr. Kevin, thank you so much for being a guest on our show. You've shared so many amazing things, and I'm going to study your website like my life depends on it. And
Well, hopefully that's not the case, but you just let me know how I can help you, and I will.
oh, thank you so much. Well,
Okay.
thank you all for tuning in for this episode of The Secrets of Being, and we'll see you next time.
Thank you for tuning in to the Secrets of Being podcast. We appreciate your time and support. If you enjoyed this episode, please like, share, and subscribe to stay updated with more inspiring content. For further inspiration, visit thesecretsofbeing.com and join our community. Until next time, stay inspired and keep unlocking the secrets of being.